Hey guys, welcome back to OncoCipher. So the topic for today is a very important topic, that is oncogenes. I cannot emphasize enough how important this topic is, not only as a student but also as a doctor for cancer patient care therapy. So let's get straight into it. Now, before knowing what an oncogene is, we must know what is a proto-oncogene. So, proto-oncogenes are normal genes which are responsible for cell growth, cell division, and cell survival. Their main function is to encode proteins that promote normal cell proliferation. So, what are oncogenes then? Oncogenes are nothing but mutated or abnormally activated proto-oncogenes. This leads to an uncontrolled cell growth because these proto-oncogenes, which provide normal cell growth, have now been mutated or abnormally activated, which has led to formation of oncogenes, and there is uncontrolled cell growth leading to cancer. So, to summarize, proto-oncogenes are the good guys which are required for normal cell function, whereas oncogenes are the corrupted versions of proto-oncogenes which drive cancer development. So, as I've said before, that Robinson-Cotran pathologic basis of disease, the tables in this book, they are indispensable. And trust me, when the time is short and revision feels impossible, these tables will be your lifeline. So, coming to this table, which talks about oncogenes, their mode of activation and associated human tumors. Now, obviously, when anyone sees such a huge table with so much information in it, our first instinct is to skip it. But this table perfectly summarizes nearly all of your important MCQs, the concepts in cancer pathology, in oncology, in oncosurgery, which is required for cancer therapy. So, this table is a must know if you do not want to go through lengthy explanations in any textbook. All right. So, how do we approach such a huge table? First, we need to understand the table structure as to what are the topics that are given in this table, and never jump to a table as a whole. You will skip it, trust me. So, we need to have it broken down into sections, which I will be doing today. So, there are 5 sections of this table, which is based on the proto-oncogenes. So, your normal proto-oncogenes, which are getting converted by some mode of activation into oncogenes. The first one is growth factor. The second one is growth factor receptors. Third is signal transduction. And lastly, there is nuclear regulator proteins and cell cycle regulators. So, coming first to growth factors, the 4 most important growth factors are PDGF beta, which is platelet derived growth factor beta. The mode of activation of this proto-oncogene is its overexpression, which causes astrocytoma, which is a form of brain tumor. The second one is fibroblast growth factor, which is again overexpressed or amplified, leading to bone, stomach, bladder, breast, and skin cancer. The third one is transforming growth factor alpha, the overexpression of which causes astrocytoma. And finally, we have the hepatocyte growth factor, which the overexpression of which leads to hepatocellular carcinoma and thyroid carcinoma. Okay, so these were the important growth factors. The next is growth factor receptors. Each and every one of this is an MCQ, trust me. Each and every one of this is used in cancer therapy. So we are not just students here, we are also into patient care. So we must know all of this. Okay. So coming first is the first growth factor receptor is ERBB1 or EGFR, the mutation of which leads to adenocarcinoma of the lung. ERBB2, which is HER, leads to the formation of breast cancer. The second one is FMS like tyrosine kinase 3, the point mutation of which leads to leukemia. The third one is RET oncogene, which leads to MEN2A and 2B and familiar medullary thyroid cancer. We have next the PDGFR leading to glioma and leukemia, and finally KIT, which causes GIST, seminoma, and leukemia. So to revise, we had the ERBB1, ERBB2, FMS like tyrosine kinase 3, RET, PDGFR, and KIT. It will be asked what these are. These are growth factor receptors. What they cause the following cancers. So we must keep revising all of these topics time and again. So the next one we'll talk about is signal transduction protein. Here we have KRAS, HRAS, NRAS, GNAC, and GNAS, all of which are point mutated, leading to the following cancers. So KRAS causes colon and lung, HRAS causes bladder and kidney, NRAS causes melanoma, GNAC causes uveal melanoma, GNAS causes pituitary adenoma. The translocation of ABL gene causes chronic myeloid leukemia. The point mutation of BRAF causes melanoma, leukemia, and colon cancer. The point mutation or translocation of Notch1 proto-oncogene leads to leukemia, lymphoma, and breast cancer. And finally, the point mutation or translocation of JAK2 causes chronic myeloproliferative disorders and acute lymphoblastic leukemia. So these were the signal transduction proteins. Finally, we have the nuclear regulator proteins, MYC or MYC, the translocation of which causes Burkitt's lymphoma, and MYC, the amplification of which causes neuroblastoma. Next, we have cell cycle regulators. Cyclin D1 translocation as well as amplification leads to breast and esophageal tumor, also mantle cell lymphoma and multiple myeloma. Finally, we have CDK4, which causes glioblastoma or melanoma. So these were your final two of the most important table in the book of Robbins when neoplasia is concerned. So this topic is not only very important for understanding your pathogenesis of various cancers, or it's an exam favorite, but most importantly, it is the key to cancer therapy. So the key for an academic success is you must keep revising all the tables, all your topics time and again. So keep revising, keep studying. All the best. Thank you.